Tonight, 1,000 dead, 70,000 infected.
It's too little, too late.
3.3 million Americans jobless as the coronavirus takes its toll on the U.S.
The bill is passed.
Congress steps in with a $2 trillion rescue package, with schools closed across the country. Plus, how to protect against COVID-19 at the grocery store.
We say go early. We also say bring in your own disinfectant wipes.
All this and more tonight on Faith Nation.
All signs point to yes. So welcome to Faith Nation and thanks for joining us. I'm Jenna Browder. House Speaker Nancy Pelosi vowing today quick passage for the $2.2 trillion coronavirus relief package. It's the largest economic stimulus plan in American history, with the hope it will begin stabilizing the economy and provide financial relief to millions of Americans. CBN News Capitol Hill correspondent Abigail Robertson joins us with more. Abigail?
That's right, Jenna. After late-night negotiations and a few unexpected speed bumps, senators rallied together to pass the largest economic relief bill in U.S. history.
On this vote, the yeas are 96, the nays are 0. The 60-vote threshold having been achieved, the bill is passed.
Now it's in the hands of the House, which is expected to pass the bill by voice vote on Friday, which allows members in self-quarantine or in states with shelter-in-place restrictions to stay home.
Right now, we have the legislation that will come to the floor tomorrow. I anticipate and feel certain that we will have a strong bipartisan vote.
The 880-page measure includes sending checks of $1,200 directly to most Americans. There would be an additional $500 per child. $130 billion for hospitals, bolstered unemployment benefits, suspension on federal student loan payments, $377 billion for small businesses to cover payroll, rent, and utilities, $450 billion in loans for larger corporations, and $25 billion in grants to the airline industry.
Our members put forward bold plans to send cash to households, stand up historic emergency loans for Main Street, stabilize key sectors, and put the full might of Congress behind our doctors, nurses, hospitals, healthcare providers, and the race for treatments and vaccines. I couldn't be prouder.
Republicans also included pro-life protections in the bill. Federal funds going to hospitals will be prohibited from paying for abortions, and Planned Parenthood is ineligible from receiving the cash designated for small business relief.
Now, both sides are touting the bill supported by the president as a big win for the American people. And they also suggest a Phase 4 relief bill could be coming as the number of confirmed cases likely increases and leads to more businesses shutting down. Back to you, Jenna.
All right, thank you, Abigail. Well, unemployment numbers are sky high tonight because of coronavirus. Last week, a record number of 3.3 million Americans filed for unemployment. That number coming today from the Labor Department. Relief checks, as Abby mentioned, though, could soon be on their way. So who gets what? CBN News White House correspondent Ben Kennedy has more on that. Ben?
Well, Jenna, President Trump tweeted, "Congratulations, America," when he heard the news that the stimulus package did pass the Senate. I spoke to Treasury Secretary Steve Mnuchin about those checks you were just mentioning, and he said depending on when the president gets the bill on his desk, we could see them as soon as 3 weeks. Abigail mentioned this in her report, but we're talking about $1,200 a person, $500 per kids, and it is based on your salary. So if you do make $75,000 or less, you will pretty much get the full amount, and then it goes down from there by $5 increments based on $100 of your income. So to give you an example, $85,000 salary would bring about $700 relief check, $95,000 around $200, and then $99,000 is the cutoff. You would pretty much receive $0. But for many of those folks, as you were talking about, Jenna, this relief check is going to make such a big difference. Let's break down the numbers that we did receive, and they are startling. A record 3.3 million Americans filed for unemployment benefits last week. It is the highest number of initial jobless claims since the Department of Labor started tracking the data in 1967. It greatly surpasses the prior record of 695,000 set back in 1982. This as the U.S. unemployment rate rose 5.5%, a level not seen since 2015. Now, it is due to the government shutting down large parts of the economy in an effort to slow the spread of the coronavirus. I asked President Trump about the impact the latest relief package will have.
Go ahead,
Mr. President, two questions. The first one, once you sign the $2 trillion package, how soon or how rapidly do you expect to see economic growth?
Who are you with?
I'm with CBN. And my second question is, we are hearing you are pushing for April 6th to have direct payments issued to taxpayers. Is that the target date?
I think it's
Again, I would say our expectation is within 3 weeks, we will have direct payments out where we have depository information. And we're looking to get a lot more information, and we have procedures to do that. So 3 weeks for that. And I would say the end of next week, we want all the banks to be able to originate loans same day.
Now, some economists are forecasting the GDP could be down by 35%. President Trump no doubt wants to get the country back open. He says once that does happen, he expects the economy, that is, to rebound like a rocket ship. In fact, today he sent a letter to the nation's governors outlining that is the new plan to gradually reopen the country. He breaks it down by counties: low risk, medium risk, and high risk. He would like to get the country or begin to get the country reopened starting in Easter, that is April 12th. But his medical advisors have been saying, look, we need to keep this fluid. That date could possibly change depending on the numbers. Jenna?
All right, we will see. Ben Kennedy, thank you. Well, Federal Reserve Chair Jerome Powell says the U.S. may already be in a recession, adding today, though, that there's nothing fundamentally wrong with the economy. He says if the country gets the virus under control quickly, economic activity can resume.
This is a unique situation. It's not like a typical downturn. We've asked people to step back from economic activity, really to make an investment in our public health. They're doing that for the public good. And this bill that's just passed is going to try to provide relief and stability to those people. The Federal Reserve is working hard to support you now, and our policies will be very important when the recovery does come to make that recovery as strong as possible.
Since coronavirus came to America, the Fed has taken steps to help the economy. It cut interest rates to net zero. It also started a bond buying program, and it began emergency programs to allow banks to continue lending to small businesses and state and local governments. And here now to discuss, CBN's chief political analyst, David Brody. David, these unemployment numbers, staggering. What's the president's mindset right now in terms of trying to get the economy ultimately back on track?
So he has a blueprint in terms of his mindset, what he wants to see happen, and then the reality is something potentially entirely different. I mean, clearly he wants to get this economy at least begin to move by Easter. The stimulus, obviously, he'll sign that into law probably on Friday night or Saturday, and then there's probably going to be more stimulus bills to come. So that's hopefully the plan. But once again, that seems a little bit too good to be true at this point. And once again, the White House now saying that, hold on, we said the president would like to get things going by Easter, but that's aspirational at this point.
Today we saw Nancy Pelosi say the House will pass this $2 trillion stimulus bill quickly tomorrow. David, though, what's your sense? Do you think this will be the last stimulus bill we see?
Definitely not. 100%. Even though this was $2 trillion and a lot of money, get ready for phase 4, the fourth stimulus bill. Remember, we saw 2 before this one, phase 3, that's $2 trillion. So now we most likely will be going to phase 4 and probably phase 5, who knows, even phase 6, depending on how long this lasts. So one thing politicians love to do is spend money, and even Republicans and conservatives who typically don't like to spend taxpayer money realize that they have to do it at this point. So, yeah, I think you're going to see that. And also I think what you're going to see, even Nancy Pelosi said this today in her press conference. She said, look, we didn't get some of those policy initiatives we wanted on the minimum wage and some of the Green New Deal initiatives in that phase 3 stimulus. Phase 4 could be different. They're going to try again. So a lot of people will be looking for that.
Yeah. David, on the topic of 2020, regarding a probable general election between Joe Biden and President Trump, I know you've been talking to some campaign operatives. What's your sense on how both campaigns are reaching voters during this whole coronavirus crisis?
Right. So both campaigns, especially the Trump campaign, is into virtual town hall mode. We saw that the other day on Fox News with the president. But it's not just the president. This evening on Thursday night, Laura Trump and Kayleigh McEnany, the national press secretary for the campaign, will hold a Women for Trump rally, a virtual town hall as well. So, look, they're all quarantined. When I say quarantined, they're pretty much not going out of their home. I spoke to Laura Trump last night, and she said, look, we're staying put in New York, but we're still going to do these virtual town halls. She admits it hurts their analytics, it hurts their metrics. They hope to get the rallies going on soon at some point, but I think we'll have to wait and see. As for Joe Biden, look, I mean, I think the first time that he spoke about the coronavirus was an unmitigated disaster. He talked about the National Guard twice in the span of 10 seconds. I mean, so it's been tough for him, and he's going to have to do a lot more than just give speeches off a prompter, especially when the prompter doesn't work.
Yeah. David, we have to leave it there, but good to have you back in the studio. Thank you very much.
Thanks, Jenna.
Meanwhile, the president says he wants churches reopen in time for Easter on April 12th. But in Los Angeles, the Archdiocese isn't risking the chance of spreading COVID-19. All Catholic churches in LA have been ordered to close until further notice.
I will take it with a grain of salt and just come here every day and pray in front of the church and understand that we have to stay 6 feet away and not gather in groups.
And it isn't clear yet when LA's Catholic churches will reopen to the public, but the closures are expected until at least April 19th. As a sign of solidarity and hope, Catholic churches across LA will ring their bells together daily at noon and 6 p.m. As Americans hunker down at home, there's still, of course, the need to go out and get groceries and supplies. So how can you protect yourself at the store and after you get home? Senior Washington correspondent Jennifer Wishon has some tips.
If you live in a place where you can have your groceries delivered, that's a great option because it keeps you away from people who could be carrying the virus. Still, plan ahead because many delivery services are slammed, and of course, not everyone has that ability. So if, or more likely when, you head to the store,
we say go early. We also say bring in your own disinfectant wipes.
Sanitize the handle of your cart before taking off down any aisles. Stay 6 feet away from other shoppers, even if it means waiting a few seconds longer to grab your pack of toilet paper. And avoid touching your face while you shop. Experts say there's no need to wear a mask unless you're sick or caring for someone who's sick. If you decide to wear gloves, be sure to take them off without contaminating yourself. Then wash your hands for good measure. And what about bags? There's growing fear reusable bags contribute to the spread of COVID-19. Several states have already banned them. But there is some good news about the items you're putting into your cart.
Right now, we don't have any clear data that it's living on packages for a prolonged period of time.
There's no evidence yet that coronavirus is transmitted via food. So once you get your groceries home, experts recommend washing your fruits and vegetables as you normally would under warm running water. You can also use white vinegar or lemon juice. And of course, items with tougher skins like potatoes can be scrubbed with a brush. You can also take your glass and your canned goods and rinse those off under warm water as well. So once you put your groceries away, take those bags, throw them away, and be sure to wipe off your countertops with an antimicrobial disinfectant. And remember, the biggest risk when it comes to grocery shopping is exposing yourself to people who may be carrying the virus, which is why social distancing remains so important. Jennifer Wishon, CBN News.
Introducing the CBN Bible from CBN.com. Now, an easier way to study the Bible and grow in your faith. Highlight your favorite verse. Read separate versions at a glance. Click and read a commentary. Or cross-reference your favorite verse using the Strong's Concordance. All the right tools to study the Bible, all in one place. The CBN Bible, available at cbn.com/Bible or the iTunes App Store.
This is CBN Newswatch.
Thanks for joining us.
Watch breaking news, exclusive stories and programs, credible news reporting.
We show you what's happening in the world and how you can pray about it.
This is CBN Newswatch, because truth matters. Weekdays at 5 on the CBN News Channel.
Yes, right on time.
From Superbook.
Pepper's Pizza Palace is donating pizza for everyone today. Wait. I have big plans today.
Trust in God even when times are tough. He has a plan for your life.
Hey, we're gonna be late for the grand opening. My parents want me to help with this outreach thing, feeding the community. What am I supposed to do here? Superbook!
Join the Superbook Club and get Superbook The Birth of Moses, plus 2 copies to share with others, all for your gift of only $25.
Pharaoh ordered all newborn Hebrew boys thrown into the Nile River, and I have a 3-month-old brother.
The Birth of Moses. Yours for a gift of only $25.
What will you do the next time the soldiers come? I do not know, but I trust God has a plan for all of us.
Superbook Club members, free streaming for seasons 1, 2, and 3 is now available.
As most of the world battles coronavirus, in Israel, a different fight is taking place politically. CBN News Middle East Bureau Chief Chris Mitchell joins us now from Jerusalem. Chris, some surprising developments today in Israel's politics.
Big developments, Jenna. It looks like there's going to be a unity emergency national government. What had been tried for several weeks, Benjamin Netanyahu has been asking his chief rival, Benny Gantz, to join him in a unity government, but he had rebuffed those efforts. But right now, today, it looks like that's going to happen, maybe in just a few days.
So, Chris, why now? You know, Israel also, of course, dealing with coronavirus cases of its own. Why this political move at this time?
Well, I think, Jenna, it's a combination of politics and patriotism. The politics looks like Benny Gantz was getting internal polling that said because he had refused to be with Benjamin Netanyahu in a national unity government in light of this coronavirus crisis, he was losing support. So if they went to a fourth election, he might have lost to the Likud and the right bloc of Benjamin Netanyahu. And also, I think it has to do with patriotism. You know, Israel is facing, just like the U.S., a catastrophe, a health crisis, an economic crisis. And so it looks like Benny Gantz, finally, after several weeks, is really putting the country ahead of his personal politics. What is happening to him, Jenna, politically, his blue and white party that we've talked about for probably about a year right now is really imploded. It was actually 3 parties together, and 2 of them have left, leaving Benny Gantz alone. But the coalition looks like it should be a strong coalition going forward.
Hey, Chris, talk a little bit more about how coronavirus is specifically impacting Israel.
Well, right now, Jenna, just last night, Israeli Prime Minister Benjamin Netanyahu put in the most severe restrictions so far. You cannot go 100 meters beyond your home. You can only go outside if you can go to the grocery store, go to the hospital, pharmacy, or the doctors. Here are some of the practical things. When we come to work now, when we can come to work, although we maintain social distancing within our office, we have to take our temperature. And when we go out, we wear a mask. I should have listened to Jenna's report. I wore this in the grocery store just a couple of hours ago. Maybe I didn't have to do that. But just like you in the U.S., we're taking those precautions as we go shopping, as we go outside or come to work. It's really the new normal here in Israel, just like there in the United States.
Yeah, new normal indeed. All right, Chris Mitchell, it's always good to see you. Thank you. Stay safe over there.
Okay, Jenna.
Coronavirus and fears of overwhelmed hospitals. Could doctors have to choose who to save? That's next.
When I came to Regent University, it's like the world opened up. I felt like I needed to advance my career and go back to school. Regent was a perfect fit for me. The Regent professors are world class. You are equipped. The focus of the faculty is on each individual student, whether it's online or in person. You become a part of Regent's family. You carry with you not just the content and the knowledge, but the confidence to understand that we can be significant in the world.
Regent University. Follow your path.
Nigerian Christians
in Iran are routinely arrested.
Happily, Christians continue to suffer.
In times of trial and affliction, you need to know the truth.
One of the fastest growing Christian populations in the world.
Join Wendy Griffith and George Thomas for Christian World News.
Young people are the ones who are open to the gospel.
Powerful stories of suffering and hope that affect all Christians. Watch Christian World News, Saturday at 5 p.m.
Get Protect Your Sleep and discover how to improve the quality of your life. A free DVD or booklet from the Christian Broadcasting Network.
If you're not a great sleeper, you can do things to make yourself a great sleeper. If you're already a pretty good sleeper, you can enhance your sleep and be even better.
5 leading experts help remove the obstacles between you and restorative sleep.
When you don't get a restful night's sleep, you wake up with an accumulation of stress.
Call 1-800-700-7000 or go to cbn.com to get your free DVD or booklet today.
Everything you do better with a good night's sleep.
You'll discover how food affects your sleep, how to put insomnia to rest, explore effective remedies for sleep apnea, and much more in Protect Your Sleep. Wake up to your best life and get Protect Your Sleep today. Call 1-800-700-7000 or go to cbn.com to get your free DVD or booklet.
With the worst of coronavirus still yet to come, there's concern about overwhelming our hospitals. Some say before long, healthcare providers will have to decide who to save. It's especially concerning among seniors and the disabled who fear they may face discrimination and be left to die. Paul Strand talked to a leading bioethicist who's working to prevent that from happening.
Professor Camosi, right now, some states, are they considering actually rationing healthcare over this coronavirus?
Yeah, not only considering, but the state of Washington State actually has an approved protocol that not only is going to consider age, but also things like ability, physical ability, cognitive ability. And that's, as a bioethicist who engages not only in Christian circles, but secular ones, that's fairly common. We're just now making it very, very public in ways that are quite disturbing.
Wow. So what do you think this is probably going to be, if the coronavirus gets as bad as we expect, do you think this is going to spread across the nation, and that, what do you think probably the criteria will be? Do you think it'll be age, disability, that kind of thing, that those people will be discriminated against?
Well, I think there will actually be quite a debate. For instance, New York, where I teach, we have a protocol from 2015. Now, it's not clear where to follow the protocol, but if we follow it, it says explicitly no focus on age or ability should be considered. And it explicitly says something that's quite true, which is this would be a violation of the civil rights of people who are older, right, and people who are disabled. So if you pit Washington State's protocol versus New York's protocol, and again, it's not clear what's going to actually be filed. That's what makes this so dramatic, is we just don't know what's going to happen. But there's quite a difference, obviously, between those two, and it may come to the HHS, Health and Human Services Office of the federal government, or even courts to decide what we ought to do.
Wow. Now, you and a couple of other prominent bioethicists have gone to legal people and asked them to send out a document to the states, right? And what's basically being said in that document to the states?
Yeah, well, the document that was set out in a press release earlier this week did a very detailed legal analysis of this and concluded, and I'm not a lawyer, I'm just a bioethicist, but the lawyers that did this legal analysis said, well, we really haven't tested this principle in a pandemic for a very long time, but their analysis is you're still not allowed to violate someone's civil rights even in a pandemic. So we're going to be rationing healthcare. I mean, the number, we just need to do the math. At this point, it's pointless to deny, unless we have a miracle drug that somehow shows up at the last minute. We're going to be rationing healthcare. The question is, will we preserve our humanity in the process? Will we follow the very basic values and ethical principles that we hold dear? Or are we going to turn it into straight up no chaser utilitarians who just say, well, we're going to maximize quality adjusted life years or something like that?
Which is funny, because doctors don't even usually will say that a patient should die long before that patient, right? So that's like the people who will be deciding these things don't even really have good judgment on this.
I know very many good doctors, good-hearted Christian doctors, also good-hearted non-Christian doctors. But in general and in the main, doctors are some of the worst people we want making quality of life judgments. They often rate their patients' quality of life below what the patients themselves rate their life as. And they also think wrongly that patients would rather have a shorter duration of life and have higher quality, when in fact the opposite is true. Patients would rather have a longer quality of life, or a longer life compared to a greater quality of life in a shorter time. So maybe we ought to start thinking about these things, but maybe doctors not ought to be the people on the front lines making those decisions.
All right. Well, thank you so much, Professor Charles Camosy in Fordham University.
My pleasure.
Still ahead, how this discovery inside a crypt could save lives from coronavirus.
Christians around the world are standing with the Israelis. But why? In CBN's free magazine, Friends of Israel, you'll discover why Christians are supporting the Jewish state, how Israel is fulfilling prophecy as a light to the nations, and ways you can pray for the people of Israel. Israel needs the support of friends like you. Call now or go to cbn.com to get your free copy of Friends of Israel.
Heavenly Father, we do thank you for the work of your Spirit, Lord God, with this movement of getting the Bible,
yes,
Lord, into public schools.
Watch The Prayer Link, Tuesday nights at 6:30.
Hey, if you're tired and exhausted all day, you can't think clearly, and you really just need a cup or even a pot of coffee to get through your day, then join me, Dr. Josh Axe, for this new series where I'm going to teach you how to transform your diet and use essential oils and supplements to get a better night's sleep.
Protect your sleep and live your best life with innovative information from 5 leading sleep experts.
If you're not a great sleeper, you can do things to make yourself a great sleeper. If you're already a pretty good sleeper, you can enhance your sleep and be even better.
Discover a sleep-enhancing bedtime routine, how to put insomnia to rest, learn how to relieve pain that disturbs sleep, and much more in Protect Your Sleep.
Everything you do better with a good night's sleep.
Wake up to your best life. Call 1-800-700-7000 to get your free DVD or booklet of Protect Your Sleep today.
Don't miss out on this brand new series.
Finally tonight, a surprising discovery in a crypt at Washington's National Cathedral has been donated to help coronavirus first responders.
Had a little bit of grace at the cathedral this week. We discovered that we had in the crypt thousands of N95 masks that we have had here at the cathedral since the possible outbreak of avian bird flu years ago. And we've discovered that the masks are still good and useful.
Get this, 5,000 masks were found inside the crypt on the National Cathedral grounds. A longtime cathedral mason found the stash. The church has now donated the masks to 2 D.C. hospitals, including a local children's hospital. Well, that is going to do it for Faith Nation tonight. Thank you for joining us. Have a great evening, and we'll see you tomorrow.